And next to what just could be the nation's current COVID epicenter, the Rio Grande Valley in southern Texas, dealing with a surge of hospitalizations and death, leaving families in anguish and doctors overwhelmed. More than 1,000 dead there, and those numbers only continue to rise. Our Marcus Moore joins us now. And Marcus, what are the medical professionals that you've been speaking with telling you about what's been happening on the ground?
Well, Lindsay, first of all, those numbers are staggering, and doctors have talked about just the sheer volume of patients they've been seeing. And I'm actually just outside a field hospital that's been set up here in McAllen, Texas, in the Rio Grande Valley, and it has tents inside. This is an overflow facility. There were dozens of people being treated here already when it opened earlier this week. It can house up to 250 patients, and it is an example of what doctors have been seeing in the hospitals here. There are 12 hospitals serving 3 counties here, about 1.5 million people, and doctors have said that they have been almost overwhelmed. We're talking about cases where patients have had to be transferred to other hospitals as far as 700 miles away, Lindsay, to get treatment for various illnesses, including COVID-19, and the doctors have been working around the clock to meet the need here. And we're talking about people of all ages, 30s, 40s, and the elderly, who have become sick from this virus. And we've seen powerful and moving images of doctors in the ERs here turning patients over onto their stomachs so that they can breathe. And we've also heard from doctors of how they have been the ones to hold the hand of someone who is dying from this disease. And they're the ones who are there with them in their last moments, because relatives and family members are not allowed into those rooms during these as their patients, their family members, are suffering.
Yeah, such frightening scenes when you see those doctors turning them over. And Marcus, before you go, give us a sense of what else you can tell us about this community.
Well, you know, Lindsay, this is a very special and very unique part of the country and part of Texas. I mean, we're right along the U.S.-Mexico border, and that's significant because you've got a lot of families, the majority of them, who spend a lot of time historically bouncing back and forth between the two countries, Mexico and Texas. It's so easy. And with that, you have a number of large families that have historically always wanted to be together. And that's one of the things that we have heard from doctors and health officials here as to the reason why this may be the next hotspot, because in the midst of this crisis that's been unfolding, you have families who want to be together. That's what they know, and especially at a time like this. But it makes this area vulnerable to this virus. And also, Lindsay, consider this. This is one of the most impoverished parts of the country. A lot of people here living in poverty, in fact, 1/3 of the people, and also a large segment of the population, they don't have insurance. And then you have people with diabetes. All of these things compounding the situation here and making it a hot spot for this virus to spread and claim so many lives.
Certainly, making circumstances a lot more difficult. Marcus Moore, thanks so much.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.